Great. Okay, so welcome to another episode of Rare BLAB, where we talk about rare disease missions and money. And we have some incredible guests here today that I've been so honored to bump into several times at rare disease events. I'm Kristen Smedley, and I'm with the Curing Retinal Blindness Foundation. I've been working for a few years on curing retinal blindness, ta-da, and have 2 affected children. So it's something near and dear to my heart. And let's have Steph, why don't you introduce yourself?
Hi, I am Stephanie Fisher. I am Senior Director of Patient Engagement and Communications at the EveryLife Foundation for Rare Diseases. And I just joined in September, and I'm thrilled to be here. I am a rare disease patient. I have a rare disease that I didn't know I had until it caused a stroke. And so this is very important to me, and I have a lot of friends in the rare community. And I love some of those friends I actually met on social media, on Twitter, on Facebook before I got to meet them in person.
Terrific, thanks.
I think Emma is one of those people that I met online before. Actually, we haven't met in person, but before.
Yeah, we haven't met in person, yeah.
But I feel like I know her from social media.
Terrific. All right, Emma, go for it.
So I'm Emma. I'm joining in from Canada at the moment. I'm also a rare disease patient from the Gaucher community, and I've over the years been involved as an advocate with organizations that represent my rare disease, as well as volunteered writing stories for Global Genes, connected with Rare Connect, which is a support, like online support groups for the rare disease community through Eurotas, which is the European organization for rare diseases. And I guess more recently I've been quite involved with a storytelling project called My Normal, which is all about sharing my own story of living with a rare disease, but also promoting a diversity of stories in the rare disease community. And being a rare disease patient, I guess, is my life. It's not my day job. So all the stuff that I do is as a volunteer. And sometimes it's a little bit tricky to find the balance in that. I guess one thing I would add too is I'm a bit of a slow adapter with social media, and so I'd like to encourage today that if that's you, that's okay too, because I think you can get a lot out of it even if you're not on it 24/7.
So that is a fantastic point, and that's our whole topic today: is how to use social media to expand our missions, to impact our missions, really to further all the work that we're doing. And I too I started this 5 years ago and was a very slow get on board the boat of social media, because as you guys know, running a foundation, there were so many things to think about, and social media became kind of the side job of it all until I realized the power of it. And honestly, I didn't realize the full power until probably right around the time of the Global Gene Summit last fall. And then NORD had their summit, and starting to make the connections through Twitter, just through the conference, through the hashtag, who'd have thought, and then making connections with people. And I should say, I should back up and say that Facebook is where our foundation began. We were able to begin because that's where the support groups were happening for parents of blind kids. And that's where I found other parents that had our specific gene mutation. Between that and the good old email listserv, if anybody even still uses those, we have one that people use every now and again. So Facebook was where I started. I was comfortable and I stayed there, and I wish I would have come out a little sooner. But like I said, we had so many things to learn, and now is a perfect time. I feel like, Emma, like you said, talking to folks that haven't jumped in as far yet, what I'm learning is, you can only do so much, right? So I learned Facebook, and then last night at my youth committee was teaching me Snapchat, and I do it in terms of, okay, how does this use terms that I know from Facebook and explain this to me? And then it was a little easier, but I really got a hold of Facebook, then got a hold of Twitter, and I'm still learning that. And then I'm branching out into Instagram and Snapchat solely for events, not necessarily for big impact for our mission yet. Now, I know that there's 800 different facets of this conversation that we can have. So we'll try to keep it to a 30, 45-minute thing, and then we'll just have to do another one because this is going to be so much fun. And we can cover all the other things. we did put the little brief outline together to steer the conversations, but obviously as things go off and things come up, we can certainly go along with that. And then for folks that are new to BLAB, there's little hands on each person's picture, and I think on the iPad you do it too, you press on them and it gives like props. See it?
Can I do it to myself? I'm gonna try.
No, try.
Apparently not.
Oh, I can't give myself props either. Oh well. So
there we go.
So that's one of the fun things of BLAB. There's lots of fun things. This has a reach that's great. So we'll send this recording out through YouTube and the website, Facebook, and Twitter. So it'll be great. So let's start with, because social media is pretty much a story that you're telling and putting out there. Emma, why don't you talk more about, I am so interested to know more about the storytelling project that you're with and the facet of your work.
Okay, so I think when we talk about storytelling these days, we often quickly connect it with social media. But from my experience as a patient, even before everyone got very active on social media and had email accounts, the way we connected at meetings, when we had the opportunity maybe once a year, or often less than that, to connect with other patients, was through telling our stories. And so social media didn't start the whole storytelling piece. It's always existed in the rare disease community. But the big difference that I've noticed is the audience for our patient stories was really small. At the beginning, it might be to our family or to our school or another group that you're connected with, or if you weren't able to connect with other patients with the same disease. And now with social media, we have the opportunity to tell those stories much more broadly. And I think in terms of mainstream media, it's always, or often, it's the same type of stories that get told. And the exciting thing about social media is when you have a different story to fit into that picture, it gives you the opportunity to share that and to share it with people in your neighborhood, in your country, and as well as globally. And if I wasn't willing to share my story on social media, there are many people in the rare disease community that I would never have had a chance to meet and to, I really feel like sharing my story on social media has improved my health because it's allowed me to connect with health providers and with support, and also to be really engaged with the rare disease community in the way that in the past I would have only been involved with my specific disease, and now I feel like I'm part of a much bigger community, and that really is through social media. So those are some of the things that come to mind, just this idea that storytelling is not new, it's just that using social media is the new part of it and allows us to take our stories to a new level. And when I think of storytelling and social media, I think of using the different avenues of social media to tell stories and also to promote other stories. So most of us, might have a website, or but we can use social media to get people to our website where our stories might be, or if we have a blog, we can use Twitter to get people to come and read larger stories. But Facebook and Twitter and all these different channels are also places where we tell stories. It's just different kinds of stories than what we're used to.
And what platform would you say you're most comfortable with and use the most?
Well, definitely we're talking specifically social media, Twitter. And I think that it's always, nowadays it's a bit confusing as to what counts as social media. And often it's all a big mix. You talked about listservs earlier, and I sort of feel like that's in a strange way part of the mix as well, because through listservs you share links, and through listservs you get people to join your Facebook book group, and so all these things kind of work together, and sometimes we can't tell where social media begins and ends.
Yeah.
But I was worked with my sister to make a YouTube video about growing up with my rare disease, Gaucher. And yeah, of course, we had, like maybe a few people that had looked at it, but it wasn't until getting onto social media that audience really grew. And I feel that's the same with blogging and with the website, that social media brings more people to stuff that you're already doing.
So it is cracking me up that you said that your thing is storytelling and you said Twitter, because I have a hard time saying hi, how are you in less than 1,000 characters. So it took me a while to get my head around Twitter's 140. And I mean, I actually was like popping champagne the day that they said the pictures don't count against your 140 anymore. Because I was trying to put pictures in, because they say that pictures really attract more people to read the tweet. So are you sharing your story on Twitter? You mentioned a YouTube video. So is that how you're doing it? You link to the video in the tweet?
So I think that's actually a really good point. So I find when people get started on Twitter, especially if they have a mission to get people to support their organization or participate in a fundraiser, you see Twitter as being just a way to constantly promote what you're doing and to link people to stuff outside of Twitter. And there certainly is value to that, but I think you also have to think of Twitter as being the storytelling place. And it's not just about promoting things outside. So if you do want to share a link, it's about putting a little story that goes with that link, or a quote that's from the story that's really engaging. I don't think it really works just to constantly be promoting stuff. And then the other thing that I really like about Twitter is I feel like there's already a lot of great storytellers on there. And the big thing for me is that I don't have to be the storyteller. I can let other people take the lead and retweet their stories, or using Twitter as a way of finding stories that Google search will never get you to, really niche stories that you would never find without your Twitter community.
Yeah, cool. I really have started to understand the power of Twitter and appreciate it. I just learning how exactly what you're saying, to use it for little pieces of the story and link to it and other folks' stories, especially in the blind community, when we feel just like the rare disease community, we feel like there's not that many of us. And then you start to find out that there is a lot more than we had thought, and connections and missions that cross over and sharing each other's stuff. So yeah, Twitter, I'm getting there. I never thought I would say that. My Facebook poster, but I had a friend that told me to start blogging because my Facebook posts were so long that they were like a blog. And blogging is something we could talk about a whole nother time, which is another form of, I consider it social media. I don't know if it's officially social media, but that gave me a reach for our mission that has been astronomical. And I put pieces of that on Twitter and Facebook, and now I'm doing video blogging, because for our blind community, it's a tricky one, because so many moms that are just having their babies diagnosed, they don't know anybody else. So there maybe a lot of rare diseases are like this. They're not coming out of the house. They're not seeing there's not a lot of role models right there in the mainstream media they can Google and find. So we're trying to do that now and put it more out there, and awareness and changing perceptions kind of thing. And social media has been great for that, especially Twitter, because you can find so many people there.
And I'll just add too, I find that Twitter is really forgiving, because things get lost on your timeline. So, I don't know, it's not the same thing as a blog story that you spent a week carefully crafting every single word. If your tweet was imperfect most of the time, like unless you say something really racy, like it's going to disappear. So I think it's kind of fun, less pressure, and you can play a little bit with it.
That's interesting you say that. I can't tell you how many I've deleted, because I've gone back like the next morning and I'll go, that wasn't what I intended it to sound like, you know, and then you go, oh, you can delete it, and it scrolls through so much. Steph, you have any opinions on all that?
I was just going to add, so one of the things that's a little bit different than what Emma said, but one of the things I like about Twitter is I find it a little bit harder to search for certain content on Facebook, but on Twitter, the ability to search for certain hashtags, whether it's for an event, and if I can't be there, sometimes I feel like I can, or if I'm live tweeting an event. In the past, I've gone back and looked at the tweets from an event and used the hashtag and been able to write a blog post, because it was basically you just follow the conversation on Twitter. And so while Emma says it's great the tweets disappear, I say it's great they don't, because I can go back and look at them or find out who's engaged. You know, in my previous position, I worked for the Pharmaceutical Industry Association, and I might look, who are the thought leaders in clinical trials? What are they saying? Are there new resources available? Are there news stories I should be reading? And so I find it a good source of, even though if it may not be on my feed, I can go back and find it based on my specific interests.
Yeah, no, and I'm not disagreeing with that at all, but I think in terms of being able to find stuff, it's great, but in terms of not feeling self-conscious and just doing something, also if people search that hashtag and what you're saying is not particularly interesting, they're just going to ignore it, and that can be okay sometimes. Mm-hmm. So, yeah. Absolutely.
I feel like it's more informal, which is how that's part of the reason I feel like I can get to know other people through Twitter, because you maybe, you know, once in a while, maybe I'm going to tweet a picture of someplace I've been, or where it's not as formal as a blog post or some of the other online platforms.
Yeah, and you know, you mentioned the hashtag, so that was another thing I just got my head around through a friend in my networking group. And I'll after this, when we post this, I'll put the link to her LinkedIn blog post real quick. It was a quick rundown of how to use the hashtag when you're going to a conference, and how to build your Twitter, but also what to do with all of that. And I went to the Big Vision Research Conference in May and had asked that question: how can I maximize? You know, there's 12,000 people that go to it. And it's all the rock stars in ophthalmology that I need to meet a lot of them. How can I get the word out to all of them? So that's what I did. I followed the hashtag, and then got into some conversations before the conference even started, and ended up in one of the presenters' slides. He had my Twitter and my blog as an example of using social media to further research. And then he and I connected at that event, and now we're going to try to do a tweet chat specifically for research in ophthalmology. Like, how do you reach all of these folks that are all over the globe and in their research labs, and have the patients that we need to find? So the power of it makes my heart skip a beat. The power of that through a hashtag. When I used to joke with hashtags, I was always walking around going, hashtag clean your room, hashtag, you know, to the kids, and they're like, stop saying hashtag. And then, you know, I'm a little bit of a slow learner. Then I come across the power of being able, that's what I love about Twitter, that you can search the information that you're looking for. Whereas I can't, maybe there's a way to do it on Facebook, but I haven't figured it out. I know the hashtags are there. It just doesn't seem as easy to do as Twitter.
I had the same experience.
Yeah? Okay.
And they're not as heavily used on Facebook, I don't feel, the hashtags.
Yeah, I feel like they used to be, and now they're not there anymore. I don't know. Maybe because everybody's hashtagging over on Twitter and Instagram. Some of the kids will put 10,000 hashtags there. So I'm going to keep an eye on time too, because I can end up.
I actually had a question. Is there a trick to sending links through the messages? Because I tried to include a link to, Emma was the editor. She may be too modest to mention it, but she was the editor of a free toolkit that Global Genes released earlier this year of how to tell your rare disease story through social media.
Oh, perfect.
And I have a link to it, but it replaces a link with a smiley face.
Would you do copy and paste?
Yes.
Oh. Okay, let me try. I've got the same one. Let's see.
It's a great starting point for people who maybe are not familiar with Twitter or aren't utilizing it.
Is that it there?
Yeah, it is.
Oh, that's fantastic. I'm going to look at that tonight. That's a great resource. Thank you.
Yeah, so the toolkits are really great resources, especially for getting started. And the first one that Global Genes did related to storytelling, they have lots of other ones, was this one, which I'll send through right now. which was not specifically about social media. But when we started to develop that one, it became pretty obvious that a big part of storytelling was social media. And so the second one focused specifically on promoting your story through social media. And they're both nice resources because there were lots of contributions, including Stephanie from the rare disease community, from people all over the world. And it brought input from people who don't always get to have this conversation as a rare disease community. How can we use storytelling? How can we use social media more effectively?
Oh, that is, what great resources. Thank you. That's exactly
and it's free.
The kind of thing. Oh my gosh. Fantastic. I know what I'm reading tonight.
Is there a trick to sharing a link? Because I have a few more resources to share later on in the
I didn't do anything special. Maybe just try it again. I'm not sure.
Okay.
I actually think, yeah, I don't know.
Are you on a laptop, Steph?
I am.
Huh. All right. If not, you can send them to me and I can maybe email them to me and I can try it on here.
Okay.
So shifting gears just a little bit, just so that we can get it all in, storytelling, this falls right into advocacy. That's what I realized with advocacy, and stop me if I'm wrong. Remember, I'm the slow learner with all this. I was supposed to be a third grade teacher. I was so good at that. And then here I am. So we were doing quite a bit of advocacy, especially for a resolution we're trying to get through the House and for government stuff, and realized that we couldn't just keep putting the information out there that we wanted people to, do stuff. We had to give the behind the scenes and show some of the kids and all that. But Steph, you can probably give the whole gamut of how you've seen that social media impact advocacy and when it's done well.
Well, so I think the storytelling is an important part. It's critical to raising awareness of rare disease, maybe getting the correct diagnosis, connecting with patients and researchers. And then the other opportunity is, how do you connect with policymakers at the state and federal level? And not only that, how do you engage your friends, your family, and get them to understand why public policy is important to you as a patient, or to you as a caregiver, or to the rare community as a whole, and then inspire them to take action. I think anyone who's joining us will know the stat that only 5% of rare diseases have an FDA-approved treatment. That leaves 95% of us with no approved option. So I'm lucky I'm able to take a medicine off label and it seems to be working well, but I have trouble with insurance coverage. So what can we do? And that's what the EveryLife Foundation is focused on, is encouraging public policy that encourages the development of safe and effective new therapies for rare disease patients. And so that's where public policy comes in. Sometimes things can be handled, FDA has some discretion and may be able to issue regulations, but in a lot of cases we need legislation to make a change, whether it's more funding for FDA and NIH, or whether we actually need Congress to legislate that FDA needs to do X or Y to encourage the development of new rare disease therapies, expedite the review in order to get those medicines to patients more quickly. And so again, social media is a great opportunity to raise awareness of specific public policy issues, educate friends and family. A little more difficult on Twitter with that character limitation, but if you can catch their attention and then provide a link to more resources. And the example I like to use is Energy and Commerce. The U.S. House Energy and Commerce Committee overtook more than a year of speaking to everyone in the biomedical ecosystem with the goal of improving the discovery, development, and delivery of new treatments to patients. They had hearings, they had roundtables across the country, they issued white papers, they were very thoughtful in the different areas of discussion and soliciting feedback. And the Energy and Commerce Committee passed it unanimously, and then it passed last July out of the House with a broad bipartisan margin, which doesn't happen a lot with the current Congress. And the Senate hasn't passed it yet, and so we're running out of time. And so because this process has been so long, there have been several different hashtags. So Path to Cures was the first one, then it was Cures 2015, and now it's Cures Now, because patients need cures now. We can't wait any longer. And so if you go on Twitter and search for the hashtag Cures Now, you'll see researchers, patients, physicians, think tanks, a lot of different stakeholders weighing in. And so that's one of the examples. I think Energy and Commerce Communications Department did a fantastic job sharing resources. Anytime there's an article anywhere in the country, or and oftentimes a blog post, they'll tweet that, and it's a way to keep the momentum. We at the Every Life Foundation, we use it. Also, you can tweet at specific policymakers. It's a little bit more effective if you're a constituent, because elected members seem to care more about the people who live in their district and are eligible to vote for them. But that's a great example of kind of putting some pressure on policymakers, showing your support for work they've done, and to encourage them to move the process along.
You know, I think it was, I'm looking it up right now. I believe it was the Every Life Foundation page about this that I used as a template for our resolution page on our website, because it has on there, here's what you say, here's what we're doing, very brief. And then the hashtag, the tweets to share. And it wasn't a ton of information. I loved it. It just gave you here's what we're trying to do, and here's the different social media platforms, click to tweet, and that kind of thing. And it was nice and straightforward and simple. It's great.
I'm not sure we can take credit for that, but what you're talking about is great if you have an organization, if you have a blog and you're inspiring people to take action. Having sample tweets just makes it easier for them, especially for people who aren't familiar with Twitter. I mean, it takes a little bit of practice in order to condense what you have to say into 140 characters, especially if you have to fit in a hashtag. If you want to thank Energy and Commerce Chairman Fred Upton, you need room for his handle. So it does take a little bit of practice.
Yeah.
So if someone has an organization or a blog and they're asking people to take action, including those sample tweets are a great way to encourage people to act. Just make it as easy as possible for people to take action.
Yeah, and you know what? When I first did ours in May, I just did like, here's the verbiage, copy and paste this in Twitter. And then, now if I can do this, anybody can do this. I built my two websites with WordPress and learned the different plugins and found the one that you put that info in there and say, click to tweet, and it does it for you. I just learned that about 4 days ago. I have my own little parties here in my office and throw confetti. I was so excited because it does make it so simple. And then then everybody just clicks that, and it makes it a lot easier than trying to figure out the wording and all that. Yeah, but that's been wonderful.
And another thing you can do too, if there's a certain issue that you're working on, whether it's an awareness day, if there's a House resolution that you're working on, I know I've seen some of your tweets and Facebook posts about it. You can also do a Storify, and I have a link for that. And so what that is, it's a free platform, and you can log on and you can search by hashtag. And what you do is you look everything. I usually do this for tweet chats or for an event. And so I'll look for the hashtag for the tweet chat or the event, and then you can pick the tweets and then put them in order. And so that's your way of telling your story.
Wow.
Because I don't want people to see just my tweets, because what I have to say is just a small part of the picture. I want them to know what Emma had to say and what Kristen had to say, and maybe Francis Collins chimed in because it was an NIH tweet chat on rare diseases. And so, especially if you're the first one to do a Storify, and you can tag people in it, and then they'll share it. But that's a great way to kind of compile tweets into a story without even writing a blog post, because if they're done well, they read like a story, and you can do titles for question number 1 and question number 2. So that's another way to leverage a tweet chat or coverage of an event on another free platform.
Wow.
Yeah, and I
so
think
timely.
that
Go ahead.
sorry, that I think also that chats themselves can be quite overwhelming for people who haven't done it before, and so creating that compilation can be a great way to get people that are nervous about joining a chat to get a feel for what that chat was about, and you kind of have a long-term record that's condensed. So I found it a really useful tool, and it looks like a finished product, so you can really see something coming out of a tweet chat. Yeah.
Oh, I'm interested to look at that, because that's my next goal of the summer, is to have a tweet chat to get in touch with to spread this whole thing for the researchers to actually find. This might sound ridiculous, I don't know, but I'm thinking that at least in our rare disease, I want to find some of maybe the younger researchers that haven't hooked onto a cause yet, or aren't buried in some 80 million other things yet, and are full of energy and ready to jump in with something. And I would think that more of those types of people would be more social media savvy than some of the researchers that we work with and love tremendously. But my one of my most favorite people of all time, when I saw she's on Twitter, I'm like, oh my God. And there was like one tweet. I'm like, come on. That's good, but she's also 72, so I don't think that we're going to be doing a whole lot of tweeting. But anyway, that's what I was thinking in doing the tweet chat. So this is so timely, at least for our mission, to be able to look at exactly how to set up a tweet chat and think of stuff like this to make sure that we do it in a really impactful way the first time.
So I tweet chats, for me, they're great to connect with, depending on what the topic is. They're a great way to connect with people with shared interests. Actually, Em and I have been on some of the same chats on rare disease. I've been on tweet chats on the importance of clinical trials. I haven't had as much time to do it, but I also think it's important to talk to each other and make connections and learn from each other. In order to, I think, to be successful ultimately on our goals, is we have to reach outside of the rare community. Mm-hmm. And so one of the regular tweet chats I like, it's called Healthcare Leaders. I will type that, it's HCLDR. And so you'll have physicians, you'll have hospital administrators, you have patients, you have quite a few different groups of people, and they have a different topic every Tuesday night. And when I have free time, I like to pop in. Some topics are relevant to me and some aren't, but I think it's important to have a patient or a caregiver perspective represented in broader discussions. I know some of my rare disease friends were tweeting during the Republican and Democrat conventions, children with special needs weren't included in your speech, or they were, they give props to the speakers who included references to our community, or would express concerns when they felt that our community was being left out of the discussion. And so because you have people looking for those more popular general hashtags, and then maybe that's how they find us as caregivers and as patients. And I just want to make sure that our voices are heard in broader conversations. And so we're not just talking to each other, which there's value in that, but I think we need to expand a bit.
Oh, I totally get it. So you guys will crack up at this now that you guys know tweet chats. I don't know if you're familiar with Madeline Sklar, the Twitter, she's like a Twitter queen, right? So I came across her through Twitter because what I was doing for 2 months, I run simply because I need to clear my head all the time. And I didn't have time to be researching stuff and fit in a 45-minute run also. So now I listen to podcasts. So I was trying to figure out the best social media platforms to invest my time in, and came across Madeline Sklar with Twitch. She's a incredible Twitter queen. And she has this podcast that's just 10 minutes or 15 minutes on a tip of how to do stuff. So she talked about tweet chats and the power of them on this podcast. I think I was actually mopping my kitchen floors. So anyway, my life, it's ridiculous, right? So I got on one of her tweet chats. I had no idea it's one of the most popular. It's Twitter Smarter. And I had no idea. I was going to try to learn about Twitter. This tweet chat, I don't know how many hundreds or thousands of people are in it. And I'm watching this thing scroll. And by the time I was trying to click, oh, great idea, 900 more tweets had come. And then I thought, tweet chats are way too overwhelming. So then somebody in the chat said, wow, this is your first one. You might want to back up a little bit and just watch. This one moves really fast. So anyone that goes into a tweet chat, know that some of them that are so popular and have so many people, they do move really fast. And that's when, I forget they were mentioning on that one, there was some things like what you guys just mentioned. You can go back later. Like I'll go back through the hashtag of Twitter Smarter later and see what tips they gave, because I can't keep up with how fast it goes because I'm not as savvy with Twitter. But then I was on, when I was on the one for our research meeting with 12,000 people, only a handful compared to that were on the hashtag, on Twitter. So that was way easier to follow, not so many messages flying. And Nord had a pretty good one recently I was on, and there wasn't a gajillion people that messages were flying constantly. So something to think about. Yeah. Silly me. I jumped right into the deep end oh my gosh. But the power of those things is incredible.
Well, those are a good opportunity. So one of the 2 years ago, I did a presentation at the Global Genes for our Patient Advocacy Summit. It's how to use Twitter in 15 minutes a day or less. Because advocates often have, as you mentioned, you may have a full-time job, you may have your own medical appointments, you may have a child or a spouse or parent with medical appointments and a full-time job and a foundation. And so, you know, social media, adding one more thing to the plate can be kind of overwhelming. So I think you can successfully use Twitter in 15 minutes a day. And it may be that 1 or 2 days a week, or even 3, that's going through and finding valuable people to follow. And tweet chats are great opportunity to do that. The hashtag for the tweet chat itself, go through and see who's sharing resources that you find valuable that you haven't seen before, who's making thoughtful points. You know, follow those people, and there's a good chance that they'll follow you back. So that's another value of tweet chats, as far as populating your stream with valuable content, and then also gaining more followers, so that when you tweet, there'll be more people to see them, to take action.
Yeah, yeah, that's great.
And I wanted to mention, I just won't let me do the link, but the simpler hashtag, healthcare hashtag project lists hashtags and tweet chats and conferences. So if you're gonna have a tweet chat, make sure you go there and register it, because there may be people who are really active on social media who may say, what are the tweet chats coming up this week? And you want yours to show up.
And it's simpler? Is that how you spell
Yes.
it? S-Y-M-P-L-E-R? Okay.
And that's another one that's free to use. I've used it to register tweet chats, and also when there's a new hashtag for a conference, I register it there too before someone else thinks of it and takes it for their own project.
Awesome. Okay. All right, so let's jump into, I talked about this a little bit in the beginning about social media for awareness and fundraising. And I had mentioned that Curing Retinal Blindness Foundation, which started as the CRB1 fund, because we're the CRB1 genetic disease, we started because I found moms in different places on Facebook groups and the listserv. And that's how we launched, and then built from there. And from that, we now have a private, I think a lot of rare diseases do this, a private group just for the patients and families that we can discuss things like IEP items. This retina specialist is not such a hot idea to go to, or this guy said this, and what do you think of this? And sunglasses, no sunglasses, eat a lot of carrots, don't eat a lot of carrots, all that stuff. Some of that is relevant on our main foundation page that's open to everybody, but the most chatter happens in that private Facebook group, which has been great, especially for extended family that don't necessarily get all the ins and outs of the rare disease. So Facebook has been, I guess that's been our #1 platform for CRB1 to connect with each other. And then to start, and we have to start doing a little bit better job of this, of telling the foundation story to the rest of the world. We actually, our first website was from some goofy little template company. It was actually called .easy, and I used to call it noteasy.com. So it was so hard for me to figure out. And all our website was stories of families and a donate button. And now it's much more enhanced, of course. But we even have like tools for raising a blind child, and we're building that into our social media platforms as well, with links to those website pages. So Facebook has been our kind of a godsend a lot of times for our families to be able to chat. And then there's also much bigger private groups for all the rare blindnesses and childhood blindnesses, where families can connect and talk about what's similar, different education issues, that kinds of things. So Facebook has been great for connecting our families together. I'm working on this year how to use it better, and Twitter better, for finding more patients. That's my goal to figure out. How to, I guess in Twitter, some of those hashtags and tweet chats to find the doctors that have the patients, the teachers that are teaching the blind kids that have CRB1 kids. Those are the goals that we're doing now, kind of taking it up another level. But so what else, what platforms and what kinds of things have you guys found for awareness for your rare disease? And the one that everyone's always asking about is fundraising.
I personally haven't used Twitter for fundraising. One of the campaigns that I've liked and I've donated to, Melissa Hogan, she's an advocate from Tennessee. Her son Case has Hunter syndrome. It's a form of MPS. And she has a fundraiser called Project Alive, and it's, her son said to her, when I grow up, I want to be, I think it was a firefighter. And her concern was, there wasn't a treatment at the time, and these children without a treatment, they won't grow up. And so it was kind of, what do you want to be when you grow up? Because now fortunately her son's now in a clinical trial and doing better. The idea was, having people think about, what do they want to be when they grow up? And when I did it last year, I talked about I wanted to be an advocate, and then I got the opportunity to join the Every Life team, so that was awesome.
Oh, wow.
Really then thinking about what it means to be a child or an adolescent when you have this death sentence hanging over you, or to be a parent of a child what do you say when someone with a fatal progressive disease says to you, what do I want to be when I grow up? And so I found it to be a very moving campaign. I'll put in her Twitter symbol, but she used Facebook and Twitter to really promote that campaign. And they had Jared Leto, they had some celebrities, some country singers, or Jared Leto, some other actors participate and do videos. And of course, Twitter and Facebook are a great way to share them. And they were, of course, brief videos because people don't want to watch generally a 45-minute video.
Yeah.
So, it was a quick, I think maybe minute or two, or might even 30 seconds. So just kind of keep that in mind if you're doing a video campaign.
Is that the max for Twitter still, or did they go up to a minute? 30? Are they still 30 seconds on a Twitter video?
I think you do a link to your video, I think.
Okay. And I think that they're still hanging at, I know Instagram went up to a minute, I think. But I think when I was on Twitter video last week, it was still 30 seconds. Yeah, but then linking to it. So did they link to it on YouTube or their website?
So on her Saving Case website, you can go and see all the videos, including mine. Although folks are probably more interested in Jared Leto's, and I don't blame them. Yeah, so I'll type in.
Yeah, and the thing is, of course, on social media, we're always encouraged to keep things short. But you can do what you want. You can make a 20-minute video and then think about, how do I make a promo video for that 20-minute video? It depends which platform that you're on. And so it's just telling the story differently in different places. If you write a really long blog post, there might be an audience for that. There might be people within your specific rare disease community that want to know all those details. And so I don't think we have to be discouraged from longer content. It's just about reformatting that content if we're using Twitter or Facebook. I think that's always really important. And also on YouTube, if you post a bigger video, it's really, really easy to cut it down and have your longer video and a short clip, which might be something that you give out more generally, and then if people are really interested, they can find the full story.
Yes, it's funny? Last summer, I was up in New York and was interviewed on this show called the Ask Bonbon Show, and it's an internet-based show, which we're here at our house in our 40s and 50s. We're still trying to get our heads around, like our millennial nieces that do not have regular cable or anything like that. They are all internet-based and Netflix and all. So it's this internet show about, and I was interviewed for the book that I have coming out in the fall, which is Blind Role Models, is basically that these people that are living incredible lives that, you wouldn't think of. And the whole gist is for a parent that just gets a diagnosis for their child of what the possibilities are. They're still out there, right? But like, Emma, like you're saying, the interview was, I think it was 30 minutes. And they gave me the video. And I thought, who's going to want to sit here and watch? So I put it on YouTube, but then shrunk it down in the Bonnie Bruder that did the interview was phenomenal at chunking the interview. So it was super simple for me to take little pieces of the different parts of the book and then just have those 2-minute like promo things like you're talking about and putting it. And now I'm trying to work on one for, my oldest blind son is in Chicago right now, flew on his own and is at this 400-person leadership conference. He's the only blind person there, and they're navigating the city and all this stuff. So now I'm trying to do just like what you're talking about, how he was able to do that, going from preschool, the things we did from preschool to 16, which could be a major promotion picture, right? It would be so long, but chunking it and then sending out in little pieces. Here's what you think about in this department. Here's what you think about. And that's a great way for the rare disease stuff too, you know, getting the diagnosis. Then what do you do next? You know, and for us, it's finding a teacher of the visually impaired, that kind of thing. So yeah, I do like the chunking. And then what do you think about, well, this is probably a whole nother conversation, but the whole, I forget what the short thing is for it. I want to say vlog, video blogging. That seems to be a really big thing now, is I guess people are just so into watching video.
Well, and I mean, Facebook Live seems that's my main exposure to it. And it seems like when you Facebook Live, and I've seen more and more advocates doing it, whether it's from a conference or talking about a child's experience or their own experience. So I don't know if that counts as I haven't tried. This is my first video discussion, so I'm a newbie to that part of advocacy and social media.
Well, and the cool thing with Facebook Live, which is what I have an addiction to, because I used to say cheap with fundraising dollars. I'm frugal with fundraising dollars. So I didn't want to be paying.
And that's what your donors want, right? Your donors want that to go to research.
Yeah,
they don't want it to go to marketing.
And now, because they put this new platform of live out, I mean, it's so intimidating at first that you go live, but they push it out they want everybody to see it. When we announced that we had the day in Congress, when I made that announcement, it was actually pouring rain and freezing here in Philly. And I did the Facebook Live with like this crazy wool hat on, because I just wanted to get the information out there and do it free. And it went to thousands of people. And I had like my phone, see my hands, it's so close because I didn't know how to do it right. And it was so funny. All of my mom's friends were calling her thinking I was on the news. Because it was like, I was so close, like this person. They're like, Kristen was on the news.
It's a good thing you have good skin, or that could have been awkward.
No, it's like the sunlight is brushing it off. But that's how many people it reached. It went to everybody that was related to my friend's thing or whatever. So I love the Facebook Live for that, because they're sending it out to her. I'm sure that they're going to start pulling that back at some point, but I'm going to capitalize all over it while I can. Yeah, it's worked out.
Yeah, and I think with all of these things, you obviously have to think about the audience you're trying to reach, and decide which channels you're going to use. But, you know, especially for me, where a lot of this work is done as a volunteer, you also have to think about what you like doing. And we don't all like to do the same things. So if you can't think of anything worse than doing a video, don't focus all your attention on that. So it really depends. I think these days there is place to do all types of things. But you have to, if you don't enjoy it, it's hard to do. Even if it's just 15 minutes a day, if you don't enjoy it, it's hard to do. So.
Yeah, and that's an excellent point. And if you're not comfortable putting yourself out there, you can even be on Twitter. You don't have to tweet. You know, you could retweet valuable content. You can, it's not, you know, you don't have to come up with something clever every day. You don't need to find new resources. I mean, to me, that's what makes me want to follow people. If they haven't tweeted, then I'm not sure what the value in me following them. But as an advocate, you know, you can retweet, even if it's your member of Congress. Like you can still get value out of Twitter, even if you're not at a point yet where you have something you want to be pushing out. That's okay too.
Yeah, and I know people that are researchers, for example, and they only use Twitter to follow stories and to get together a list of people to follow, and they don't do anything but use it that way, and I think that's fine. I actually can't stand, I can't believe I'm admitting this, but I don't like Facebook. I feel like having a rare disease is not something that I want to deal with on Facebook. And with great reluctance, I joined Facebook recently, and I use it almost entirely for private groups. And I find great benefit from that. And there are different kinds of groups. One's a creative writing group, one's a disease-specific group, and I just participate that way. And I think everyone has to decide what it is that they want to do on social media. Don't let people tell you, well, you have to be on Facebook or you have to do this. Obviously, if you're representing an organization, it's a slightly different discussion. But I think there is space to participate in different ways and get value from it.
Great points. All right, so we're going way over my 45-minute attention span thing. So let's just wrap up maybe a tip or two, and then how everybody can get in touch with you guys, whatever platform you prefer to put out there, or if email is the best, whichever one. So Steph, what do you think for some quick tips wrap up?
Well, I have a few links, but I'm not able to share them, so I'll send them to Kristen. The other thing I wanted to mention is I'll be joining Melissa Hogan, who's Saving Case, the advocate who I mentioned who had the project alive. We actually are on a panel discussion at a breakout session at the Global Genes Rare Patient Advocacy Summit in Huntington Beach, California, September 22nd and 23rd. And the main stage is webcast. I believe the breakout, I'm not sure if the breakout sessions will be, but if they are, I encourage you to watch. We're at 2 o'clock Pacific time, and it's the sessions on effective social media engagement. And the links that I'll share with Kristen, I did a breakout session at Rare Disease Week on Capitol Hill this year, and that was talking about, went over the Twitter basics. What do you want to do? How to find followers? And I also have links. There was the World Orphan Drug Congress had a list and then updated it of influencers or rare disease. And so that's a good place to start. You want to make sure, well, you want to check them out and see if there are people you want to follow. But generally, I think the World Orphan Drug Congress folks did a good job of pulling some of the influencers. It's, you know, you would expect Nord's on there and Global Genes, but there are also some really thoughtful advocates on there as well. So I'll get those links to Kristen to post. Since
is RDLA still doing, are you still recruiting folks to have lobby days?
So registration for that ended, but we are encouraging anyone who's participating and meeting with their U.S. representative and senators to thank their member of Congress on Twitter using the official hashtag, or I'm sorry, their handle, the elected official's handle, and then share a photo of the meeting. And we did that for Rare Disease Week very successfully. Usually I was able to fit the name of the member, a photo from our meeting, and then depending on how long the member of Congress's name was, I might be able to fit in, hope you will join the Rare Disease Congressional Caucus, or kind of fit in and ask, but it is a little challenging in 140 characters.
I know, right? And what's the best way for folks to get in touch with you?
Sure, so you can find me on Twitter as Rare POV for Rare Point of View. The Every Life Foundation is everylife.org, and Rare Disease Legislative Advocates, which is a program of the Every Life Foundation, is Rare Advocates on Twitter. And I can do my email address. Let's see if it will let me. If this will let me, I'm happy to share my email address if people want to follow up.
Terrific. Yeah, there you go. Awesome. Thanks. Emma, how about you? Last thoughts?
So I've mentioned some things, but it sounds really silly, and we're all in love with our small devices. But I always think that if you're getting started on Twitter or Facebook or participating in a tweet chat, sometimes it can really help to start on your desktop or laptop, because once you get a little bit more familiar with how it works, then you can move to your smaller devices. But that's always a big tip for me, for people getting started. I'm very much an all or nothing person, and so I appreciate the reminders from Stephanie that you can really do this in 15 minutes a day. But I also think it's good to remind people that social media is one of these things that if you fall off the wagon, you know, you can, I've experienced, you know, there's times when I've been really unwell or I've been preoccupied with other parts of my life, and you can go back to it. And there's the rare disease community in the social space is pretty welcoming for you to come in and out as you can do it. And it's better to do a little bit than nothing at all, and to always keep that in mind. And another thing is, I always encourage people, once you get started, to help other people out. So we all, even if we're not experts, we all can help somebody else. So whether it's, I know for me, I'm connected with the National Gaucher Foundation of Canada, and the president of the board there wanted to get on social media, and so I said, okay, for every day for a month, I sent her a little email with a couple of tips or people that you might want to follow and things like that. So you don't have to be an expert to help other people out. And it's not just an age thing either. So because, my dad always says, oh, you're young, you can help me with my social media. And I always say, no, it doesn't just always work like that. There's lots of experts to learn from when you're getting started. You don't have to do it alone. And it's okay to make mistakes. You're not going to be kicked off and, unless you do something really that you shouldn't be doing. In terms of how to contact me, you can, I don't think this is working. Did I sound good? Yes, sorry. I have there, this is my normal web page. There's also my handle for Twitter. And then this is actually something else that I wouldn't mind promoting. This is on the My Normal page. I've compiled links to many different resources in the rare disease community for stories. And I think we're all looking for different types of stories. And so this is a place to find some of the ones that are out there. Of course, there's lots more. And it's a growing list. So if you have others to share, send them along.
Awesome. Well, thank you both so much. This information, like I said, we could talk about all these different things all day long. I appreciate you taking an hour out of your summer afternoon here for me. And I'm just amazed at the fact that there was so much information, great information and takeaways packed into just a few topics that we steered this around. So I so appreciate it. I know I'll see both of you on Twitter, and Steph, I might be able to join the lobby day, so I'll talk with you about that. And and definitely I'm actually bringing my whole board of directors to the Global Gene Summit this year to kind of divide out to all the things, and maybe I'll have everybody in the room for social media.
Awesome. So, Kristen can always be depended on to not be shy and ask good questions.
Yeah, I'm always the one in the room asking the big questions. I can't help it. I figure it's my one little window of time that I'm going to learn as much as I can. So,
but I think that's great because some people aren't comfortable standing up in front of the room, and if you have the question, there's probably someone else who has it too. So I think it's great when you do that.
Oh, thanks. Well, thank you guys. This is
not good to be.
Go ahead.
Not fun to be a speaker when no one has questions, because then you assume that you've bored everybody. So that's another plus in asking questions. They know that you were engaged and paying attention.
Oh, great. Thanks. Well, thank you guys. This is great. And then I'll send the replay when it's available. So that'll be available through BLAB. And then once I'm able to upload, I'll put it up on YouTube and we'll start sending it around. Thanks.
Great. Should I send you some extra links that it didn't let me send, or?
Yeah, because then I'll put them in YouTube notes and I'll put them on Facebook and all that kind of stuff.
Okay, great.
Thank you.
Bye.
Bye.